try not to mix up the tablets, the pills to be taken by mouth. Don't mix it up with the ones that you are inserting, please. Welcome back to my channel. If you are new here, my name is Reetahh and this is Tea Spill with Reetahh, where I talk about health, lifestyle and Christianity. New videos drop Wednesdays and Sundays of every week, so if this is the kind of content you would like to keep up with, then click on that subscribe button and join the family. And if you are a returning subscriber, thank you for tuning in once again. So today I'm going to be talking about vaginal yeast infection. It's also called vaginal thrush. Now before we get into this video, you must know that a vaginal yeast infection is not a death sentence, okay? It's not an STI, it's not a sign that you are dirty, so don't feel bad, don't feel ashamed if you're having those itches down there. Also, another thing you must know is that this thing is very common. Almost all women are going to have it at some point in their lives, so I'm going to just talk about what this is, what causes it, what kind of symptoms actually indicate that that is a yeast infection, what you can do to treat it, and also what you can do to prevent it. Yeast is normally present in the vagina. Wow. Yes, it is, as it's present alongside the healthy bacteria, which is lactobacilli. Yeast is in small quantities, so it doesn't cause any harm to you. But then when that normal bacteria, which is the lactobacilli, when it starts reducing and then the yeast starts increasing, there's this overgrowth of yeast, that is when we could be going to a yeast infection. Now, what is vaginal yeast infection? It's just the overgrowth of yeast in your vagina. Candida albicans is just a normal regular guy, chilling in the vagina. It's what causes like 90% of the vaginal yeast infections. So when you provide this candida the opportunity to, grow, it will grow. Now, what are the signs that you're going to see to say, oh, okay, this could be a vaginal yeast infection? One is itching. The point you start noticing some itching, then you know that something is really going down. Sometimes the itching can be mild and sometimes it can be intense. It's really hurting, you're itching and you can't stop. You end up hurting yourself. It could be the inner lips that could be itching, that is the labia minora. It could be the area between the vagina and the anus that could be itching. So any of those areas could really get itchy. Then there could be discharge. It's not in all cases that you're going to see discharge. Some don't actually come with a discharge, while some come with whitish discharge. The whitish discharge could be smooth and it could also be cottage-like. Also, there could be painful urination. You go to the toilet, you pee, and you notice that when the pee is coming out, you're feeling some kind of pain while urinating. So painful urination is another sign that could be indicating or pointing fingers towards a vaginal thrush. There could also be soreness, burning or irritation of the vagina. So if you notice that you start having some kind of burning or irritations down there, along with these other symptoms, you could also be suspecting this. Painful sex during the whole coitus and all, it could be really painful and uncomfortable for you as the lady. So if you've noticed any of these signs, you could be having a vaginal yeast infection. What could actually cause this yeast infection? One is the overuse of antibiotics. Most of us are guilty of this. Any little thing we feel is an infection, we go to treat it ourselves. Even go. These antibiotics, in as much as it wipes away the bad bacteria, it also wipes away the good bacteria. So take note of that. Another thing that could cause this is the change in the pH of your vagina. And what could cause those changes? Washing your vagina. The vagina itself is self-cleansing. I said this in my previous video. If you've not seen it, go check it out. It's self-cleansing, okay? You don't need to use a hose and force water into your vagina, and then using of all these scented wipes, scented tissue, scented menstrual products. anything scented. You don't need all those things because they could change the pH of your vagina. They could cause some kind of dryness or discomfort, so we don't want that. Okay, pregnancy. So most of the pregnant women always come down with a vaginal yeast infection. Most of the pregnant women treat a vaginal yeast infection. So if you're pregnant and you're having these symptoms, go see a doctor and get proper treatment. If you are diabetic or you have a weakened immune system due to any other illness, it could also be one thing that could be leading or could cause this particular yeast infection. So how can you treat this? You've seen that you fall in this category of everything I've mentioned and you're wondering, what do I do to treat this? There are the creams where you can rub around the vagina to like relieve or ease of that discomfort or itchiness. And there's the tablet from these drugs are basically antifungal medications. However it is that it's prescribed by your doctor, if it is just to take one tablet and that ends the treatment, or for a specific number of days. And there's one that comes in a bullet form, so you insert it into the vagina. Try not to mix up the tablets, the pills to be taken by mouth. Don't mix it up with the ones that you are inserting. Please do not. So please seek the advice of a healthcare professional if you want to go down this treatment. If you have treated this infection and notice that your symptoms are not going away or they've gone but then they keep on coming back, some of these signs could actually be indicating another illness. So you might need to actually see the doctor to do further investigation. We are going down to the prevention. Please try not to self-medicate. Try to reduce the amount of antibiotics you take. Also the products, all those scented products, just stop using them and stop douching as well.
My future, my hope, all my stories, all my struggles, all my hopes. What will I do?
Also, the kind of detergents you use on your panties are also important. So please don't use harsh detergent on your panties. Use a mild soap. Now, how do you wipe when you go to the toilet? You should know that when you're wiping down there, please wipe from front to back, not back to front, so you don't pass the bacteria that is in the anus into the vagina, because they are not friends. So you're just going to cause a lot of problems for yourself. Then also you need to avoid wearing tight clothing. Are you the kind of person that will wear pants, wear tights, wear leggings? When you're just packing yourself with all these things, you're not allowing air to get to the place, so it will make that whole place to be moist and sweaty, and we don't want that. So avoid tight fitting clothes. And finally, when you've treated this infection, try to change your panties, because you could be reintroducing the infection. So once you're done treating, just change your panties, get a new set of pants. They're not really expensive, so just do it for yourself. So that is a wrap for this video. Thank you for watching. Thank you for staying till the end. Please help me share this video. Drop a comment in the comment section. Like, share, subscribe, and I'll see you guys in my next video.